Stepping off the plane into Barrow, Alaska, I was hit full in the face by snow blowing sideways. I knew it was going to be cold, but in the middle of June I wasn't expecting it to be that cold. The landscape reminded me of a post-apocalyptic film. If the outside seemed completely inhospitable, the inside was the opposite. We were greeted by a wall of heat and dozens of middle school kids running around the college. In Barrow, it seems that people need an extra dose of internal warmth to compensate for the harsh environment. Having grown up in Valdez, I was familiar with the crises of obesity, alcoholism, drug use, and depression throughout the state, but communities like Barrow feel these challenges the most. Without access to fresh produce and with the high price of groceries, the most accessible nutrition is junk food. Even in Barrow's public health facilities and hospital, the staff are often as overweight as those they treat. Barrow makes it clear that you can't separate healthcare problems from the larger problems of a community. Interprofessional practice in Alaska isn't a choice, it's unavoidable. We didn't meet a single person who our guide, Daniel, wasn't on first-name terms with. If there's one thing that unites the citizens of Barrow more than anything else, it's whaling. The community of Barrow is still strongly rooted in the cultural and practical uses of bowhead whales. From making the skin boats to bringing in the whale to preparing muktuk, whaling brings the community closer together. Despite numerous challenges, Barrow finds ways to remain close-knit and keep Inupiat culture alive.
I was welcomed by the warm smiles of the people and breezes from the ocean in Petersburg, Alaska, located on Mitkof Island. Soon afterward, I realized the importance of the fishing industry in molding the culture of the people. With limited resources, personnel take great responsibility to be self-sufficient and creative in thinking, oftentimes needing to assume multiple roles. Preventive care is a huge focus to minimize the need for higher levels of care, a sense of community collaboration, teamwork. It can be a great challenge to maintain privacy and to keep people safe when dealing with domestic abuse in a community where everybody knows everybody. Through observing professionals at the medical center and visiting Wave Clinic, working against violence for everyone, something resonated with me. I see the great value in really knowing who the patients are and providing individualized care and to create an environment for patients to feel comfortable and safe to seek help and share their issues. The charm of Petersburg sparkles through the interwoven qualities of a small community where I saw healthcare team members truly care beyond the management of diseases, to treat a whole person's well-being. Through the doctor's words and actions, the importance of educating patients, providing emotional support, and the responsibility of the patients for their own health was depicted. As a future physician, I aspire to possess the same qualities. In Petersburg, the one and only medical center truly keeps the pulse of the community.
As I hopped off the plane and onto the ferry, the sunny weather of Ketchikan complemented the natural beauty of this coastal city. A feeling of fellowship came over me as I traveled through the island and saw the integration of historic Tlingit poles with modern-day buildings. For an island in the southeast region of Alaska, Ketchikan provides many healthcare resources to its community. One of the strengths of Ketchikan is the implementation of community members in different task forces that work to remove stigmas and educate the community on provided resources. The practice of healthcare strongly benefits from these interwoven relationships of Ketchikan. These individuals were not just members of one group, but multiple groups working to make a difference. One of these examples is the Ketchikan Public Health Center, partnering with local schools to help bring vaccinations to children who might not otherwise get them. With such natural beauty, it was easy to bypass the challenges of the community. One of these challenges is the battle with behavioral health and homelessness. I had the privilege of providing meals to some of these victims. For me, it was a way to help, or for the people we fed, it held more meaning. Although the community struggles with behavioral health, innovative techniques are being applied to address these problems. I have learned the effectiveness of a collaborative community working towards changes in local healthcare.
If there's one thing we've found here in Alaska, it's that community is everything. Community is both the cause and solution of widespread healthcare issues, especially in rural areas. We discovered this in our rural locations, but also in our own little community. We not only gave each other sore throats and fevers and bothered the hell out of each other at times, we also cared for each other, covered for each other, and learned from and with each other.